At this time yesterday, President Trump was announcing his belief that autism may be linked to the use of Tylenol by pregnant women. But that press conference touched on a host of other topics, including Lucaorin, which the president described as a potential treatment for autism.
Our medical expert, Dr. Pyle Coley, is with us this afternoon. I haven't heard of Lucaorin, if I'm being honest, before today.
Yeah.
What is it?
It's a medication we use in patients who are in chemotherapy who receive methotrexate. It's basically a derivative of folic acid. So it's an active form of folic acid because some of us don't have the enzyme to turn folic acid into this active derivative, essentially.
Okay, so the FDA says it'll approve Lucaorin for treatment for autism. Is that safe for kids?
Yeah, so let's talk about why they're thinking of Lucaorin in autism. So some kids with autism, and emphasis on the some here, actually have a deficiency of folate getting into the brain. And we know that folate or folic acid is involved in metabolism, it's involved in neurotransmitters, it's involved in how the neurons communicate with each other. So it's important. So there's been some randomized trials that tell us one child with this deficiency of folate getting into the brain gets Lucaorin, one doesn't. The ones that get it do a little bit better in terms of their behavior, their verbal communication. So that's the promise of this therapy.
And I know I just feel like we need to revisit it because this affects so many women, but President Trump coming out and saying pregnant women should not take Tylenol, you should not give it to your babies. One more time from a medical expert, your opinion on that.
So this is an association, not a causation. And I'm going to say that again. This is an association, not a causation. Meaning, what do we know between the link between Tylenol and pregnancy? We know that having Tylenol in your umbilical cord blood increases the baby's odds of having a neurodevelopmental disorder. But again, it could be mom took Tylenol for some other reason. So could this just be a marker of risk, like a fever, high-risk pregnancy, a headache, an infection, or is this actually contributing to the risk? And the science out there, the largest study to date is this Swedish study with 2.5 million kids, where they look to see whether or not within the same family, so you're talking now about two siblings related to each other, same parents, same environment, was there a difference between the pregnancies where mom took Tylenol and where she didn't? And they didn't find a difference. So again, we're just thinking it's an association, a marker of risk. We have not proved causality. And it is one of the safest things that mom can use during pregnancy to treat fever and infection, which we know directly hurts baby because it affects the blood flow to the placenta. It also affects neural development if you have a fever early in pregnancy, and it affects labor later in pregnancy.
I keep hearing the analogy. There's a rise in ice cream sales in the summer, and then there's a rise in violence in the summer. And just because those two things exist, it doesn't necessarily mean that one leads to the other.
That's right. So it's a marker for summer, right? Because they both happen during the summer. And so that's really what we're trying to tease out here. But it's impossible to do some of this science, and that's the problem here. And some studies have actually shown a protective effect of Tylenol during pregnancy. Some have shown a null effect. So the data is inconsistent. And moms recalling how much Tylenol they used, how often they used it, it does appear that more chronic use may potentially be a higher marker of risk, again, because maybe mom is sicker or something else is going on. But we know that autism is caused by so many different things. It's so complex and multifactorial. Obviously, over 100 genes that have been linked to autism spectrum disorders, how those genes are turned on. So even our behavior and how it influences those genes, as well as environmental exposure. So hard to pinpoint on any specific thing. I'm a little surprised that the FDA has approved Lucaorin for autism spectrum disorder because it's only in those subset of kids and it's very early in its clinical trials. But what I really want to see now is more long-term safety data. If we start to use this treatment for children with autism, in the short term, it appears to be safe. It doesn't appear to have any long-term toxicities, maybe a little GI upset, but certainly important to keep a lookout for that data.
President Trump said a lot yesterday, and we don't want to miss anything because he also recommended patients ignore the widely accepted vaccine schedule. What were those remarks about?
Yeah, so he basically said, we should think about not pumping our babies full of too many vaccines. Obviously, the hepatitis B vaccine for newborns is under review right now as well, and he suggested that perhaps we should separate out the measles, mumps, and rubella vaccines as well. Yep. And the American Academy of Pediatrics has responded saying that this is a little dangerous and a little bit misleading because certainly these vaccine schedules have been made with a lot of careful consideration about public health problems, and keeping in mind that newborns and toddlers have a very naive immune system. So their only sort of layer of protection is those vaccines that we give them to teach their immune system how to fight the infection without actually getting the infection. So if we alter that vaccine schedule or take it away, it might affect that. And again, the American Academy of Pediatrics has very strongly said there is absolutely no causation between vaccines and autism. Vaccines do not cause autism, and that's what they're reinforcing.
Why is it so hard to find the root cause of autism?
Yeah, it's just one of those things that has the scientific community really sort of confused. And I think it is because there's so many different things that go into it. It's also the fact that it's very difficult to do studies on pregnant moms. It's not ethical. It's difficult and unethical to do studies on young children, right? Randomizing young children to treatments or interventions, that's obviously very difficult as well. We're also seeing that autism may be linked to advanced maternal age and advanced paternal age, which, as we've seen over time, there has been a trend in the United States and other countries for people to have children later in life. So there's so many moving parts and factors, the genetics, the way the genes are turned on, the environmentals, the exposures, as well as a lot of behavioral things such as devices like social media and tablets, that there's so many variables it's hard to sort out what's causing it.
Mm-hmm. Well, I know this is a conversation that's going to keep going. Dr. Coley, we'll continue to ask you about it as the months go on. We appreciate it.